Are you experiencing severe hip pain and your doctor has recommended hip replacement surgery? Hi, I'm Dr. Mark Adelsheimer with Regenexx Pittsburgh, Southwestern Pennsylvania's premier provider of non-operative regenerative solutions. Let's talk about one of the most important decisions that you will need to make. Do I need to have a hip replacement? What are the risks involved with hip replacement surgery? Are there any alternatives that may be indicated for me? These are all very important decisions to make, and an informed decision is necessary. Stay tuned, and I will address what's involved with a hip replacement and whether or not alternatives may be indicated for you. So when is hip replacement actually necessary? Hip replacement is necessary when someone is suffering from severe end-stage osteoarthritis and it has a significant impact on your quality of life. When you're not able to do the things that you want to do or need to do because the pain is too severe and there are no other options. The best time to prevent a hip replacement is before you get to this stage. Because let's talk about what's involved with the hip replacement. Hip replacement is major surgery. This is done in a hospital, in an operating room. It often takes 2 to 3 hours to perform this procedure. There are significant risks involved with major surgery, including infection, bleeding, nerve damage, blood clots, and even death. These are all significant risks that happen, especially when they're done in a hospital setting and with the severe nature of this surgical approach.
Hi, this is Dr. Lieber from Regenexx Pittsburgh. I know that your health questions and your pain condition can be overwhelming at times, but we're happy to answer your questions either in the comment box below or just by calling your number, and someone will reach out to you.
During the surgery, a surgeon is removing your natural hip joint and replacing it with artificial substances that mimic the original hip that you were provided with. When hip arthritis is end stage, this may be your only option, but our goal is to treat this and help prevent people from getting to this point. Also, keep in mind that after hip replacement surgery, the artificial joint is not the same as your natural joint, and this can often lead to problems later in life for individuals who undergo this surgery. A common problem is a leg length discrepancy, making walking difficult after hip replacement surgery. Also, these artificial joints do not last forever and can become defective, they can loosen, they can even become infected. And these are all potential risks with hip replacement surgery. Also keep in mind that recovery from hip replacement surgery takes several months. You will first be in a hospital, oftentimes need to go to a rehabilitation facility afterwards, and then spend several months in physical therapy and doing your own exercises to get back to where you were, to the level prior to undergoing hip replacement surgery. So keep in mind that this is a major procedure done in a hospital with significant potential risks that requires extensive long-term rehabilitation, and also there's no guarantee that this will provide you with the pain relief and the function that you will obtain down the road. So the question then becomes, can hip replacement surgery be avoided? And the answer is yes, and the key thing is to address hip problems early. So as soon as you are experiencing some discomfort in your hip or in your groin, if you have some stiffness noted when you're trying to walk or exercise, if you're having some difficulty sleeping at night, see a physician at that point, and there are very good treatment options to help so you don't have to go down the road of undergoing major surgery in a hospital with significant risks involved. So let me tell you a story about one of the patients that have come to see me in our practice. Joe was a very active 45-year-old male who liked to participate in sports, and he played in an intramural soccer league on the weekends. He was injured when he fell onto his left hip, and he was told by his orthopedic surgeon that he's going to need surgery. He underwent an MRI, and the MRI showed that he had a tear in the labrum, which is a deep ring of cartilage deep inside the hip. His surgeon told him that the only option was surgery for this, but he wanted to look for a different solution. Joe came to see me in our practice, and I correctly identified his labral tear and told him that no, there are other options for this problem. Specifically, I was recommending a PRP solution, which is using his own platelets to help to enable his body to help improve his hip condition. Joe did elect to undergo the PRP procedure. He had minimal to no downtime, and within 6 weeks, he was back to playing soccer. So if surgery has been recommended to you for hip conditions, you should seek a second opinion before automatically jumping into undergoing surgery. So if pain is disrupting your life and a surgeon has recommended surgery for your hip, remember that there are non-surgical options that may be available to you. Here at Regenexx Pittsburgh, we provide interventional, regenerative, orthobiologic procedures using your own platelets or your own bone marrow concentrate, which can help to improve your hip and the integrity of your hip. In our next video, I'm going to discuss non-operative regenerative treatments that might be available for your hip, and also briefly discuss some rehabilitation and exercise techniques that will help you to prevent worse hip problems.